New question, member from Etobicoke South.
Long-term care. Speaker, I begin by quoting the late MP Arnold Chan from Scarborough Agincourt, who said in his final address to the federal parliament, "I would ask Canadians to give heart to their democracy, that they treasure it and they revere it." Like former MP Chan, Speaker, I know that our government believes that everyone in the province deserves high-quality health care that is compassionate, timely, equitable, research-based, and in the best interests of our patients. In particular, that includes those fighting substance use disorders, which are increasingly prevalent. Speaker, we've been clear as a government through the past year that what we're dealing with is a crisis. The opioid crisis has unfortunately taken far too many lives and led to debilitating dependence and addictions. Last year, our government put in place the most comprehensive opioid strategy in the country and also announced additional investments in this file. Would the minister please inform this House about the critical investments our government is making to provide urgent support to those affected by the opioid crisis?
Thank you. Minister of Health, Long-Term Care.
Thank you, Mr. Speaker, and thank you to the member from Etobicoke North as well for giving me this opportunity. And I want to start, if I can, Mr. Speaker, by acknowledging those who have tragically and needlessly, Mr. Speaker, lost their lives due to the public health crisis that we're facing, the opioid crisis, Mr. Speaker. Regrettably, 865 precious souls, individuals, lost their lives last year. That's a 19% increase from the previous year, nothing like what they're seeing in BC, where they saw an 88% year-over-year increase, but nonetheless, a single life lost is a tragic loss to that individual and their loved ones. And I want, Mr. Speaker, also to acknowledge and recognize the true heroes of our healthcare system, the frontline workers whose commitment and compassion under extremely difficult circumstances have saved the lives of so many. Mr. Speaker, the lives of those with opioid use disorder or substance use disorder, those lives matter. Those people are valued and they're important, and they are not alone, Mr. Speaker.
Thank you. The member from Etobicoke North and supplementary.
Thank you, Speaker, and thank you as well, Minister, for your stewardship of this important issue. As we know, we've attempted to bring to bear a number of investments, critical as they are in the healthcare system, to ultimately benefit individuals, families, and the communities that are fighting these substance abuse disorders. And I have to say, Speaker, that I have personally witnessed in both a parliamentary and professional capacity the results of those investments. Speaker, our sloganeering opposition believes that merely banning pill presses is the answer to the opioid crisis. In contrast, our government recognizes, as with all things concerned in medicine, that we need to address the spectrum of issues, in particular to prevent new instances of opioid dependency and also to care for those already affected. Speaker, I'd like to ask the Minister of Health and Long-Term Care to weigh in on why banning pill presses is merely a band-aid solution to a public health crisis that deserves a full-spectrum treatment.
Thank you.
Thank you, Mr. Speaker. And if I can, let me be clear on one thing. Focusing on restricting access to pill presses in Ontario is not going to solve this issue. In fact, the federal government has already passed legislation that prohibits and bans and makes illegal the importation of pill presses anywhere into this country without a license, Mr. Speaker. But this is an issue which is far more complex and multifaceted and can't be, in fact, I would argue that a illegal drug manufacturer in his basement, the last thing that he's concerned about is the legality of the pill press that he's using to make illicit drugs for distribution on our streets, Mr. Speaker. But this opioid use disorder crisis deserves much more from us, and that's why we've invested to date almost $300 million over the next 2.5 years, Mr. Speaker, and it's everything from the distribution of naloxone, more than 7,000 doses of naloxone going out each and every month, to making rapid access to medical treatment, support, detoxification available to those who do seek help, and many other things, Mr. Speaker.